If you think you have erectile dysfunction, which is also called ED, or you've already been diagnosed, there are a lot of different treatment options that are available that may help you regain control of your sex life. It can be very helpful to learn about the available treatment options, and I'm going to work with you to determine which solution is the best treatment option for you. Treatments include, for erectile dysfunction, oral medications, penile prosthetic implants, penile injection therapies, vacuum erection devices, and insertable medications. Oral medications with names including Viagra, Cialis, Levitra, Stendra, which are probably household names to you, are the most common first-line treatments for erectile dysfunction, and typically oral medications have to be taken 30 to 40 minutes before sex to produce an erection response to stimulation. An option that a lot of people are not familiar with is the inflatable penile prosthesis, like the Titan implant from Coloplast. This is typically an outpatient procedure which provides a long-time solution for erectile dysfunction. And these were invented to look, feel, and perform like a natural erection and are placed completely inside the body through a very small incision, either through the scrotum or above the penis below the abdomen. Another treatment option for erectile dysfunction are penile injections. It sounds just like what it is. It's a treatment which requires you to give yourself an injection in the penis after we teach you how to properly do it about 20 minutes before sexual intercourse to get a strong erection. A vacuum erection device is another valuable treatment option for erectile dysfunction. It is essentially an external pump that you place your penis into and then create a vacuum, and that pulls blood through the blood vessels into the penis to give you an erection. Once you're erect, you pull off a silicone constriction ring down to the base of the penis, and that helps you maintain the erection. And finally, a less commonly prescribed treatment option are the insertable pellets or creams that you place with an applicator inside the penis through the urethra or the urinary channel. And once it dissolves and gets absorbed, it can give you increased blood flow to the penis and give you an erection as well. Well, there are some pros and cons with medications. The oral medications have been very proven for efficacy. Maybe about 60% of men are able to get and achieve a good erection that's satisfying for intercourse. But although the oral medications tend to work for many, maybe most of patients, they don't really work for everybody. Maybe about 40% of men don't even respond. If you have pre-existing conditions or you're taking certain medications such as nitrates for cardiovascular disease, this treatment is not really an option for you because of the contraindications. With these medications, you can experience side effects as well, such as headaches, flushing of the face, upset stomach, pain in the muscle, joint, and nasal congestion. When the oral medications are no longer effective or they're not available, a penile prosthetic implant can be an effective and long-term treatment for erectile dysfunction. This ED solution allows for spontaneity and puts you back in control of your erections without the hassle of pills or needles or any clunky equipment. And it's very reliable, and the erections can last as long as you want. Like every surgical treatment, there are potential risks and complications with penile implants, and the most common risk, but not limited to, would be a device malfunction such as breakage or leakage, potential infection or inflation difficulty, erosion or incorrect sizing, and they can make latent natural erections as well as other treatment options no longer possible. Penile injections are another option. These treatments work very well in some patients, but they do require you to inject yourself with a needle and with the medication into the penis rather than taking a medication by mouth. This can be a little bit cumbersome, and some brands require refrigeration, and they can take 20 minutes sometimes to be active and give you the erection. And there's not a lot of spontaneity. And in 30% of the cases, the penile injections are not even effective, or they cause priapism, which is an erection lasting longer than 4 hours, which is very dangerous and requires a trip to the emergency department. Other side effects could be penile pain, numbness, irritation, bruising, fibrosis, plaques, or scarring. And as I stated earlier, the vacuum erect device is an external pump that are placed over the penis. And this option requires no medication injections or any invasive surgeries, and it works fairly well for some men. But patients that use vacuum erection devices may have a learning curve and discomfort. They find that the equipment is bulky and cumbersome, and you may experience an erection that becomes cold to the touch, and maybe you don't even get an erection that's satisfactory. As mentioned, the insertable medications are pellets or gels that are inserted into the penis through the urethra, and the erections might start within 10 minutes and last, 30, maybe 60 minutes. But there's side effects with this too, including burning, aching in the penis, maybe even in the groin. Insertable medications do require refrigeration sometimes, and the spontaneity diminishes. Well, determining which treatment option is best for you is different with every man's journey, and erectile dysfunction is different with each man. I look forward to the opportunity to sit down with you and assess your specific situation and your expectations, and to create a treatment plan that is right for you. Not only are penile implants very effective and a reliable solution, but they do have the highest satisfaction rate among all the treatment options that you can think of and that we can go over. A study of the Titan Coloplast penile implant patients reported a 98% satisfaction rate, and their partners were also satisfied, reporting very close at 96% satisfaction rate. One of the long-term consequences of not having erections is a loss of penile length. Like any body part that goes unused for a long time, the muscles and the fibers of that body part begin to break down. If it's been a long time since you've achieved a good erection, you may experience some loss of tissue or atrophy in girth, which can result in shortening of the penis. Additionally, given that the arteries to the penis are smaller and prone to earlier blockage, erectile dysfunction can be an early indicator of other health issues such as cardiovascular disease, making this yet another reason for us to discuss your erectile dysfunction.